Hi, everyone, and welcome to the Lympha Press Educational Webinar Series. It is the top of the hour, and we are so excited to bring this topic to you this evening with a dear friend and really important voice in the world of lymphedema therapy and treatment. And I want to tell you more about Louisa Boyd, but first tell us about yourself. Who is logging on? Where are you logging on from? Are you a patient or a clinician? We love when people tell us who they are in chat because it's not just a one-sided conversation. And to that point, please do put your questions about this topic in the Q&A. And at the end of Louisa's presentation, we will navigate through all of your questions and hope to answer every single one of them. I will say that this is a topic that we are super interested in. Negative pressure manual therapy is a tool that can enhance lymphatic drainage as well as provide soft tissue mobilization in the treatment of fibrosis and other symptoms of lymphatic disruption. Science and research in 4 different techniques, including the use of different cupping tools, will be presented tonight. I really can't wait for this presentation. It's going to be awesome. And our presenter is Louisa Boyd, OTR, CLT-LANA, the Clinical Collaboration Director at the National Lymphedema Network, a renowned lymphedema occupational therapist specializing in breast cancer rehabilitation and neurovascular lymphedema. With 30 plus years of clinical experience, she combines her vast knowledge and expertise with an empathetic therapeutic approach to treatment. I have seen that on display in person, and it is such an honor to have Louisa here to present with us tonight. Remember, questions in the Q&A, we will get to them at the end. Yes, I know you're all wondering, is this being recorded? It absolutely is. It will be posted on the Lympha Press website. Everyone who registers will receive a link to the replay. And of course, it will be on the Lympha Press YouTube channel. I forgot to mention, I am Brenda Viola here on behalf of Lympha Press this evening. And now I get to pass the baton over to my friend, Louisa Boyd.
Thank you, Brenda, and thank you, Lympha Press, for having me as a panelist. This is so exciting. I'm looking at all of these people from all over, so many from Australia. I hope I just don't disappoint you all, but let's do some negative pressure training here. So I'm going to get my slideshow going here. Okay, so again, this is negative pressure manual therapy for lymphatic conditions. A lot of people call it cupping, but for the most part, I think the official term is negative pressure manual therapy. So who has not seen this picture on Instagram or TikTok? Maybe some of you saw this at the 2016 or 2006 Rio Olympics. That was Michael Phelps, who was the swimmer. We saw those bruising marks all over. So while we are going to be talking about negative pressure, we're not really looking at myofascial decompression, which is what you're seeing there. We're going to gear this more towards the lymphatics. And this presentation is really kind of focusing on someone who's a certified lymphedema therapist or has like the foundations of lymphatics in their practice. But if you're a non-clinician, please don't go away because there's so much information here that might be great for you to share with your lymphedema therapist and integrate this in perhaps a home program. So stay on. So there's 2 mechanisms that go on with negative pressure manual therapy. So there's the macro strain, which is that actual tissue deformation that you see when you're actually applying the tool to the skin and it's pulling that tissue up. And so when that happens, that increases the lymphatic pump frequency. It also can be used to mobilize that fibrotic tissue. And as you recall, a lot of us know now that chronic lymphedema has fluid present above and below the fascia. So we need to be able to get deeper. And then also we know that with chronic lymphedema, the vessels actually become sclerosed, and it's really important for us to mobilize that as well. So microstrain, so that's what happens on the cellular level. So that's that electrical charge or the piezoactivity that stimulates fibroblasts for collagen fiber production. And that can happen within minutes of the application of the tool. And then also microstrain helps in stimulation of vasculogenic growth factors. This is what we see with those negative pressure wound therapy devices. So when you're looking at combining negative pressure manual therapy with mechanical vibration, you have both a global effect and a local effect. So with the global effect, you're activating your central lymphatic system, you're activating and relaxing soft tissue, you're working with pain modulation, and you can also achieve neurological stimulation. And then on a localized level, you're stimulating those regional nodes and collectors. You're also reducing adhesions and fibrosis and mobilizing scar. And a little bit later, I'll talk a little bit more about this. But when you apply negative pressure and you activate relevant mechanoreceptors, you can have a pain modulation effect as well. So there's a couple forces going on. So that negative pressure applies a pulling force to the skin to reduce the internal pressure. And that those pulling forces stretches those anchoring filaments that we know about, and that allows that interstitial fluid to enter into those initial lymphatics, the pre-collectors, and then the collectors. And then we have that directional flow that's achieved in the direction where we want the lymph to go, and there's those metabolites being used with the negative pressure device. I think this is a great visual to see what's actually happening. So when we're looking at positive pressure versus negative pressure with MLD, so positive pressure, which is, using our hands, can create a pushing force to produce a pressure higher externally than internally. And that in turn reduces the lymphatic load by facilitating reabsorption of the interstitial fluid. So other examples besides MLD would be our compression bandaging, myofascial release, I-stem or A-stem, and also pneumatic compression devices. And then just general exercise. When you're looking at negative pressure, you're creating a pulling force to the tissues to reduce the external pressure and lower the internal pressure. And that pulls and stretches the anchoring filaments to allow the fluid to enter those initial lymphatics, as seen in that video we just did. So other examples of negative pressure would be the diaphragmatic breathing, elastic taping, traditional Chinese cupping, those wound therapy devices like with negative pressure wound therapy. So talking points that we're going to go over in this presentation is, contraindications. Well, yes, there's several. What is the evidence? I'm going to go over quite a bit of that. And then, measuring pressure, which has always been a topic that I'd love to go over and discuss. And then what are the costs of some of these devices? So they can be pretty cheap and they can be pretty expensive. Contraindications. So just like with MLD, there's absolute and relative contraindications. So absolute contraindications would be, of course, organ failure, anybody who's not well enough to handle the negative pressure. So that'd be liver, kidney, heart failure, people with hemophilia, active cancer. In fact, negative pressure is very uncomfortable for people who have an active cancer. Of course, you wouldn't want to do it over a fresh bone fracture. People who are on anticoagulants, DVT, chronic conditions, open wounds, 6 weeks postpartum. You don't want to use it on eyes or orifices. You don't want to use it on the thyroid or the aorta. And of course, you wouldn't want to use it over a pacemaker. So some of the relative contraindications, and I know this sounds really odd that they put inflammation, but inflammation is a very general term. I think if you're using inflammation and you're not really realizing what is the source of that inflammation, that can be very dangerous. So we're going back to looking at doing a good clinical evaluation and using your good clinical judgment when you determine how and what types of modalities or interventions that you want to do with your patients. So the only other thing in here that's not obvious, varicose veins. So we do use it on phlebolymphedema, but of course, you just want to be mindful about where you use the negative pressure. You wouldn't want to do it over a very distended vein. Also lymph nodes. So we are going to be showing videos where the negative pressure is being used exactly over a lymph node. Sometimes people have lymph nodes that are inflamed and they don't really know why they're inflamed. And of course, we want that person to have a good clinical exam before we start with any type of intervention. Okay, so what would you notice about this diagram? When you look at the deep cervical nodes, you'll notice that it's just, they wrap around the internal jugular vein. So this can be kind of a controversial subject because I know there's a lot of people who do head and neck lymphedema and use negative pressure, but I want you to be mindful about when you're using negative pressure on a large vessel such as this. Myself, I do not use it over this area. Other therapists might, but if you have some plaque buildup or anything that might be contraindicated for this patient, you want to be very careful about using negative pressure. So let's go over the multiple clinical studies I have. So first of all, I want to talk a little bit about mechanical vibration. So what happens with mechanical vibration when that's applied along with negative pressure? Oops, excuse me. So the anchoring filaments are also expanded through that stimulation of vibration, and that allows the interstitial fluid to be reabsorbed. So it's just actually, it's icing on the cake when you have negative pressure and vibration together. But we know now that it is really important that you know the parameters. And so some of the most important parameters for vibration would be frequency, amplitude, where you're placing it, how long you're placing it. And that's because you can switch from pain inhibition to excitation when the signals become strong enough. So it's really important that we understand the parameters of our vibrational therapy. So now we know that, well, what are the best vibrational parameters to use when you want to modulate pain? So in this study, it looks at the mechanoreceptors of the Pacinian corpuscle. It's one of the two vibration sensitive mechanoreceptors, and it looked at that as being the target mechanoreceptor, but it also looked at what vibrational frequency was ideal for pain modulation. So they looked at 12 hertz, 50 hertz, and 80 hertz. And what they found that 50 hertz was ideal for pain modulation, but once you go much above 80 hertz, it can turn from a hypoalgesic effect to a hyperalgesic effect. And it's not that we don't ever want to use higher frequency vibrations. It's just that we need to be mindful about the vibration that we're using and why we're using it. And as you can see, the Pacinian corpuscle and the Lympha blood vessels are almost adjacent to each other. So this is a guide that was taken from the Lympha Touch manual. And I think it's really important because it kind of gives us some parameters on what pressure levels are ideal for what type of tissue. So when you look up at the top, sensitive or aged skin, you probably want to start at a MMHG of 20 to 50. I also like to use that for people who maybe are geriatric or maybe a pediatric patient. You want to start with the lowest pressure that that patient can tolerate. Then you get to 50 to 100 for normal tissue. And I probably go in the lower end with the lipedema patients because they have a lot more pain, especially around those nodules. And then when you get to 100 and 200, you're looking at doing some myofascial decompression where you're working with the deep fascia and scar. And that really, really indurated skin, you might go up to between 200 and 350. So changing the pressures accordingly to the types of tissue that you're treating. Now, when it comes to pulsation, that is that working phase, resting phase, a shorter pulsation will be more of an activation feature. So if you want to do some neurostim, but a longer pulsation is more effective for fascial decompression. And we're going to talk in just a second a little bit about what is the best pulsation. Okay, so now we're down to vibration. So 90 hertz is going to be more superficial. It's for liquid transport. 40 to 60 hertz works a little bit deeper. So I use this a lot with my lymphedema patients. And it also is remember, if that modulation of pain ideally is 50. So I might work between 40 and 60 hertz in a lot of ways with my lymphedema patients. And then 20 hertz is used for working with deeper fibrotic hard tissue. Okay, so this looked at using near-infrared spectroscopy to see how pressure can affect deoxyhemoglobin. And what they really are coming to the conclusion is that duration and pressure can have a large effect on the deoxyhemoglobin. So it does matter the length of time that we use something to get the desired effect. Okay, so we're going to talk about, well, how do you measure pressure if you don't have a fancy device at home to do that? So on the left, that's a manometer. So that's what this little device is. And my husband and my son helped me rig this up because I wanted to be able to use a cupping device to see, like, well, how can I measure pressure? Because all we have is this like little pump system. So if you look on the left, if I do about a half a pump, I can achieve 100 mmHg. So you can use muscle memory to just kind of give that guide of about 100 mmHg, which is a pretty normal function. And you can just modulate your pressures depending on your patient's response. On the right, this is called a cupping gun. And this is put out by cuptherapy.com. So you can apply your cup, and then you can create the trigger to get to the achieved pressure, and then you can hit that trigger again and you can stop. So that's another way of measuring pressure without having an expensive device. Okay, so I told you a little bit later about the duration of the pressure. So it looked here at this, is looked at pulsation and what was the ideal pulsation for activating lymph. And so they looked at a 2-second pulsation with a 1-second rest. And then they looked at a 4-second pulsation and a glide. So it's a best visual here in the left lower corner. And it looked at that as being the most effective pulsation to induce higher fluid pressure and velocity. So yeah, so the gliding at 4 seconds ideally is better than just doing a stationary 1 second or 2 second pulsation. And it was 27 times more efficient. So let's look at lipedema. There's lots and lots of studies out there looking at the pathophysiology of lipedema. I just wanted to highlight a few because this could be a whole session just alone. But we know that we need to prevent the progression of this disease in the earliest stages as possible so that we can protect the integrity of that tissue. And that dilated capillaries may alter sensory nerve function. And sometimes we even experience neuropathy with these patients. And the lipedema tissue suggests that fat has hypertrophic adipocytes. And in obesity, hypertrophic adipocytes are markers of inflammation, fibrosis, angiogenesis, and metabolically changed fat. And then, as Dr. Herbst has done so well, is identifying a lot of this pathophysiology. And she has mentioned that lipedema has extensive fibrosis and that deep tissue treatment is needed to reduce that inflammation, fibrosis, nodules, and fat, and that negative pressure reduces fibrosis. So this is a case of mine. I had a lady that I saw for lipedema. She stage 3, she was type 3 and 4. She came to me. She has done quite a bit of different things to try to get her condition under control. But she was much more effective when she did CDT, and she also took place in a weight loss program. But as you can see, especially in your upper arms, that we did the negative pressure manual therapy along with compression. And you can see the changes in the texture of her skin. It's much smoother. She just did really well with the treatment. And I just wanted to use an example of one of my patients before I showed you a bunch of other patients, that it's really an effective treatment, but it's not a standalone treatment. It does require other parts of CDT to make your patients reach that optimal level. So some of you might know Edie McKenzie. She is a massage therapist. She works a lot with the Vanderbilt group, and she did a very interesting study on a patient who had lipedema, but also Ehlers-Danlos syndrome. And as part of her CDT, she used gentle cupping to support mobilization of the fascia and scar tissue. So this is looking at breast cancer-related lymphedema, and they wanted to compare traditional MLD with negative pressure manual therapy. And they used LDEX scores as their measure. And they found that up to a year later, that the patients who had the negative pressure manual therapy had better scores. And then axillary cording. This looked at using a vacuum sealing drainage device. I believe what they're referring to is a negative pressure wound therapy device. And they applied that in the axilla where the cording was, but they also did some manual lymphatic drainage prior to this negative pressure device. It doesn't say how long they left that pressure on, but 450 mmHg is a very high level. But basically what they found is that compared to a control group, this group had, improvement of their cord and much faster, shorter duration of treatment. And this is a great article. It has so much information in it, but what it was looking at was that just with pain and MLD, that stimulation of the touch receptors along the spinal cord, it always results in inhibition and becomes stronger when you stimulate the neighboring receptors. So I always like to go along the paraspinals with my negative pressure device if I have a patient who's complaining of a lot of pain. And that MLD affects the smooth muscles of the lymph collectors, which are innervated by the sympathetic nervous system to reduce firing of the system and dilate and fill lymph vessels. And so this is a post-operative swelling. So this looked at circumference of an effective limb post-op 7 days post-operatively. And they found that when they had patients who received negative pressure manual therapy, and then they had other patients who received MLD, traditional MLD, although the circumference was very similar, they were more often found that their visual analog scales, their pain perception was much lower. I kind of think that if they would have done some bioimpedance, that might have been a better measure as well, instead of just circumference. So this is a case report of a patient who received negative pressure manual therapy for their axillary cording, but they also received cold laser. But what I really like about this treatment, it actually shows how long, what treatment cup they used, what pressures they used, how long they used it. And this patient had significant improvement in just, looks like 8 60-minute treatments. So that was very interesting as well. And they had a lot of improvement in their pain as well as their dysfunction and a lot of their skin softening in just a couple treatments. So this looks at myofascial decompression. So this is working a little bit deeper. But I feel like this is very important because the deep fascia can be a source of pain, and that it causes fascial alterations, and that when you have that happening, it alters the gliding, the ability for the tissues to glide. And those sugar proteins, Dr. Herbst talks a lot about the sugar proteins with lipedema, but the proteoglycans and the glycoaminoglycans, hyaluronic acid, they occur in high levels in the loose connective tissue, which may be an essential role in the etiology of pain. So I think this is kind of interesting, and it goes along with, I think, what she says a lot about lipedema, and that the fascial remodeling can alter that pathological collagen fibers and produce new collagen. And here's another example of a patient who received negative pressure manual therapy. She was a 27-year-old lumpectomy. She had a lot of restriction and pain and lots of ADL loss from being able to wear a bra. She only had 4 treatments. Again, she used a good idea, give us a good idea of what they used: 350 mmHg with a 10 mm head, which is really quite small, and 15-minute intervals. And there was significant change in her tissue. She had reduction of pain, reduction of tightness. This is a patient of my own. This lady, when she came in to see me, she had a total shoulder replacement, and she apparently had 25 years of lymphedema. She had never received any treatment. She had extensive radiation, and she only had about 45 degrees of abduction. So when she came in, it wasn't really for lymphedema, but it was for, basically a frozen shoulder. And so we started using negative pressure manual therapy and softening that skin. Of course, we did compression bandaging. We got her into appropriate compression for day and night. So it was part of her CDT, but at the end of treatment, she had a functional abduction of 120 degrees when she started with only 45. She was able to put her compression on. She was able to put her bra on, her clothing, everything. And she was also doing silver sneakers. She was doing great. And then I saw her probably about a year later. She came in for measuring for new compression devices, and she had even better range of motion than before. So just really pleased. And you really can't even tell that she has lymphedema in that right upper extremity. So this is looking at using negative pressure manual therapy for patients post-operatively. And what they found is that they called it the Rice Plus method, where they started to employ negative pressure manual therapy as part of their post-operative treatment. And they had significant improvement in their patients' edema, their range of motion, and pain, as well as mobility. So I'm going to just kind of have you just glance at this, but there's not very many studies out there looking at negative pressure manual therapy in real time. So what they're using here is Doppler. They're applying the negative pressure in either the inguinal lymph nodes, the axillary lymph nodes, and looking at the flow of lymph and the depth of that penetration. So what we're seeing is that if, with a certain frequency of about 90 hertz or 60 hertz, how deep does it penetrate? And you also see that the fluid is being pulled towards the lymph node. So I think that's very effective in showing us just what happens in real time. So now we're going to talk about the cost of devices. Well, there's lots and lots of devices out there. There's some that you can buy on Amazon, probably, for $25, these little silicone ones, but the silicone ones, you really can't measure pressure. There's some very expensive ones. You can probably achieve in a device between $6,000 and $15,000, depending on the device. But there's quite a bit out there, but it's not to say that you can't start with something, especially if you are trying to give your patient a home program. You can start with something to help your patients. So we're going to look at these different techniques. So there's 4 different techniques: stationary, a glide, lift and twist, and combo. So this first one that we're going to look at is the stationary. First of all, we're going to talk about application of an emollient. So when you're using negative pressure, It's always wise to put an emollient on the skin so your cup can glide. And it doesn't matter whether it's an oil or if it's a lotion or a cream, but you just want to put enough on there so that your cup will skate across the skin. Okay, so now we're going to talk about the stationary method. So on your left, let me get that started. That's when you apply the cup to the tissue. You do a resting, an active phase and a resting phase, and then you can move the cup or keep it there and do multiple pulsations in the same area. On the right, that's using a cupping device where I do about a half a pump. Remember I told you about 100 mmHg is applied, and then you use that little toggle just to pull that device off. I don't have a picture of the silicone ones just because I don't have a way of measuring that pressure. So I prefer to show you things that I can give you a rough idea about pressure. So this one's called the lift and twist, and that's where you're applying that device and you're just mobilizing that tissue right underneath you. Really good for fibrosis and scars. And this one on the right, I'm kind of doing a glide and a lift and twist on the right, but you kind of get the concept of moving that around. So this is the glide. So when you apply the device, you're gliding, and hopefully we're trying to achieve that 4-second glide if we possibly can to get the most effective treatment. But applying that and then just gliding the tissue in the direction that you want to do. And then this is the combination. This is where you're combining a stationary, a glide, a lift and twist, however you find it to be important, so that you can see all the different ways that you can move that tissue. Okay, so I'm going to show you a little video of me using, this is a speed reel, different ways that I use negative pressure in my treatment. I'm not a person who likes to just use a standalone negative pressure. I like to combine the negative pressure with my hands. And that's a neuropathy treatment right there where you're putting it on, and then head and neck. So I like to stimulate the lymph nodes of the head and neck, and then use my hands to provide the NLD as well. So you can move everything around. And I think our patients appreciate that. They like the combination of both of our tools and our hands. So those are my references, and just wanted to just give a big shout out to everyone who are healers out there. We've got our superpowers going, and I really appreciate this opportunity to share. And let's have some questions.
Thank you so much. I was fascinated by your videos. Thank you for including them. And you could definitely see the difference, the befores and the afters. It also looked like it was an easy modality to use, making me think that ultimately, not to ever eliminate the role of the therapist, but that it would be really beneficial to the patient at home for their own use. Is such a thing available?
And yes, and I often will have my patients, of course, I think it's really important is to be able to have them understand that the pressure that we're trying to achieve. And yes, it's a very effective method is for a home program. And I think it just is so easy on the hands, and almost everyone can do it.
So we have a question from Nikki Cardani. Can you repeat how much pressure you provide when using the cup?
Okay, so good question, Nikki. So when I talk about, if I'm very fortunate that I have an electronic device where I can actually modulate the pressure. It really depends on what I'm trying to achieve with that tissue. If I'm trying to work deeper, I'm going to use higher pressure. If I'm trying to work more superficial, I'll use lower pressure. But just my little go-to is if you do half a squeeze, that's going to give you 100 mmHg. So that's a good place to start. And of course, and if I'm going to go do a full pump, I'm probably going to get 250 to 300. So I always like to start low, go slow, and work from there. And remember, are we working, what layers of the tissues are we working? Are we working on the superficial to get the lymphatics? Or are we trying to work a little bit deeper into the fascia? And you can just modulate that according to what you're trying to achieve.
Excellent. Shelley Shores, we're so glad that you're with us tonight as well. What tools are available to achieve the vibration with the negative pressure?
So I will use a brand name because it's the only one that I know of that does that, and that is the Lymphatouch. The Lymphatouch, actually, I think that's what's so special about it. It combines the negative pressure and the vibration. So I know that there's therapists out there that will do negative pressure and then they'll come back and do some vibration. You can convert RPMs to hertz if you use a calculator. That way you can kind of know. Some devices are out there. There's one out there that I found that actually does tell you what the hertz is on that little vibrational tool. But most of those, like percussion gums, they're RPMs. So you can maybe do one and then switch and do another.
And Diane Hayes would like to know, how was the hertz applied?
So the hertz is applied through the device itself. So when you have the cup on it, you can actually touch, it's like a little computer. So you can turn vibration on or off. So you can have negative pressure without vibration, or you can pick and choose the vibrational settings. So that's what's kind of nice. It's, you know, it's a computer generated mechanical vibration.
So we had questions that had come in before you addressed lipedema. There were many people in the audience who were wondering, well, if this works for lymphedema, does it for lipedema? Thank you so much for addressing that. Many of these patients deal with pain. What does it feel like when you're using this Lymphatouch?
Very good question, because I actually feel like I am on the spectrum. And the first time somebody treated me with the Lymphatouch is just like, oh, let's try this device out and see what it feels. It was so painful, and it was only on like 80 mmHg, which is the default for normal tissue. So that's, you know, really that's in the normal tissue range, maybe on the lower end. And so what I found is that it is, and you have to be very careful when you're working with a patient who has lipedema, and you really want to start on that lower end. But it's very effective in treating, so you get that neurological response, but it also is very effective in treating those nodules that you'll see. You know, I can really feel them right along here. I can feel it on my thighs. Yes, it's really important. So my lipedema patients probably are the ones that will rave the most about the change in their pain. And I really feel like it's that neurological response. So I usually pre-treat areas where I think it's going to be painful. I will pre-treat it with a vibration, with a very low negative pressure. And then when I start to work on that glide and maybe deeper tissues, I'll, you know, titrate that pressure up a little bit, but always be mindful that this can cause pain. So you just have to be a little slower on that.
And so is it the pain, and forgive my questions, but I'm so intrigued by this, and I'm actually at the FDRS conference right now with many lipedema patients all talking about pain. So how do you know when to pull back?
You just are always looking at your patient, communicating with your patient. One other thing I will mention, and I'm just going to use this cup. When I'm working with a patient, and of course I can't do it to myself, but I will take one hand and pull some of that excess adipose tissue. I will stretch it, and with my other hand while I'm gliding it. So when you have a lot of excess adipose tissue, it is so painful because it gets kind of caught up in there. So you want to kind of use your therapist hands to kind of gently pull that while you're putting the pressure there. I hope that makes sense.
It does. It does. And we have more questions that have come in. Elizabeth Soto wants to know, is it possible to use the higher pressures without leaving big salami marks on the patient.
Absolutely, absolutely. And so I really want to caution people when, usually I'd say this in my presentation, but I did not today. So my apologies, but thank you for that question. I don't leave it in one place more than maybe 15 to 30 seconds. I will always remove, because I'm not trying to create disruption or peticuli or anything like that, like what you would see with myofascial decompression. I don't want to leave marks on my patient. Sometimes you will. And I don't try that, but I'm always mindful to tell the patients that I'm not trying to achieve that. If you have that, let me know, because I need to be a little slower, a little less pressure. So always start slow, low and slow, and move, and you'll get comfortable, and you'll kind of be able to find the level where you want to start a patient.
Is there a recommended millimeters of mercury and cup size for neuropathy?
So I did not show that video, but depending on, so with the neuropathies on the hand, of course, see, this would be a perfect for my hand, but if somebody had a larger hand, you want the largest cup that would fit that area. If it's in the feet, you want to put in the soles of the feet. So you want to have the largest cup that would fit in the soles of the feet. And the prescription for that, the dosage of the prescription for that is 250 to 350 mmHg, depending on the size of the patient. I would start 250. It'll go on for 5 minutes in a sustained suction. The hertz would be 90 hertz. So that's the only time I would leave a cup on for a long period of time, is if I'm doing the neuropathy protocol. And that neuropathy protocol, a shout out goes to Johns Hopkins, because they're the ones who invented that protocol. And the history behind that is that their lymphedema patients who were receiving negative pressure immunotherapy as part of their lymphedema treatment were all reporting that their chemo-induced neuropathy was getting better, and they didn't know why, except for it had something to do with that device. So they actually came up with that protocol. And there's a group of doctoral students at Belmont University in Tennessee, and they actually did a little capstone study, and I can't remember how many patients they did, but they looked at their grip strength, their fine motor coordination, their two-point discrimination, quality of life, and ADL function. And I think they only did like 6 or 8 treatments with these people, and they had significant improvement in all areas, and they continued to improve over a month period where they came back for their follow-up. And myself, I've used it on people who didn't necessarily have chemo-induced neuropathy, still benefited. I saw a lot of hand patients where I would do the neuropathy protocol, and they all had significant improvement. So it's that combination of the negative pressure and the vibration at the same time that is the magic.
So one more neuropathy question from Rebecca Zender. Has there been any change in the neuropathy without the vibration component?
I have never seen a study like that, but I do know Wilma Hazelwood, and she's in Pennsylvania, Philadelphia, Pennsylvania. But she was using TENS unit and having a lot of. They were actually doing a study. Holy Redeemer, I believe, is where she was at, and they were using a TENS unit for neuropathy and having a lot of good results. I don't know what the protocol was, but TENS units are very, everyone can get one.
Sure. And where can we find the Johns Hopkins neuropathy protocol? That's being asked by Elizabeth Soto.
Just me. I don't think they put it out there, but I've been talking about it for 13 years. Kathy McGinty is the one who told me about it, and that was back in 2013, I believe. So I just talk about it. I believe also on the LymphaTouch website, that Belmont study is available in their clinical help book, which is downloadable. You can get that on the LymphaTouch website, and that Belmont University is the one, and it probably is in there.
Okay, excellent. So a compliment from Denise Stewart. She says, love your work. Love your work on measuring negative force. Also clearly stating working at different levels. Measuring strain capacity of the individual's tissue is important. Do you have a system approach to measure the individual's tissue strain capacity, manual, device feedback, MAP-BC? I don't know if I said that correctly, but
yeah, Denise is the only person I know that has that kind of scar measurement tool. So if you all don't know Denise Stewart, she is the guru of breast cancer rehab and scar mobilization. So I know she has a course. Hopefully she's coming back to the United States to teach that. But I personally don't, and I'm just going to take a shout out to all the therapists, how we try to do so much in our practice, and it's just so hard to have all these measuring tools out. So yes, Denise, if you can make it easier for us, we certainly would appreciate that.
I love that these webinars sort of are on the cutting edge of what's new, what's emerging. The more tools we have in our toolbox to take better care of patients and for patients to take better care of themselves, that's why we do these webinars. We want to shine a light on what's available out there. How were you introduced to this modality?
Very good question. So I go back to Wilma Hazelwood. She is I was on the LANA board, and I was very fortunate that I came on with a lot of gurus that I could ask these questions. So as a new therapist, I really didn't have a lot of mentors. And so I learned a lot. I went to the NLN, and there was the Lymphatouch device was being used there. Kathy McGinty was probably one of the first people that I saw. She was actually demonstrating using it for axillary cording and things like that. So I was very fortunate to get a trial on the device. And once I got a hold of it, I saw other patients other than lymphedema patients. I used it with my hand patients, my shoulder patients, my neuro patients. I used it with so many different patients that I think I just became really proficient at it. And I had a lot of questions about vibration, because at that time, really no one could tell me why is there even vibration built into that device to begin with. So a lot of that was just learning and researching.
And thank you for sharing it with us. A few more questions. Of course, Lympha Press is sponsoring tonight's webinar, and I have to wonder and suggest clearly that the combination, and you mentioned, of pneumatic compression and a device like the Lymphatouch would be really powerful, like a 1-2 punch.
Absolutely. The more tools that we can put in the hands of our patients, it's going to make everybody's life more effective. So I think everyone needs, a toolbox. All of our patients are asking for, what can I do for myself? And you don't want to just tell them, put on your compression. You want to give them some tools, especially with fibrosis. It's just, it's 24/7. It's happening. So yes, if we can treat with pneumatic compression and these other tools to mobilize soft tissue, we are ahead of the game.
That's where we want to be, ahead of the game. LaDonna Dingle wants to know, are there any classes or workshops that you would recommend for her to gain hands-on experience?
Well, I'm so glad you asked. So at the NLN, we've been dabbling more and more into modality training. So this September, we are going to be doing a modalities workshop as part of our 2024 offering, and that's actually hands-on. So we'll be diving into multiple modalities. I'm going to be doing the negative pressure. I hope that we can provide this, repeat the modalities around the country where our therapists live. We want to be able to get out to the therapists now, instead of having it in one particular place, try to move about. So if we are successful with this modalities training, then we will repeat it. I do a lot of online webinars, just where I demonstrate more in depth the different applications for different conditions. But as far as I know, I believe that Cup Therapy does a training, but they're not geared towards our type of population. So I hope that answers your question. You'll come to the NLN.
I am excited about that. So stay tuned. And if you're on the list serve, the communications for NLN, I'm sure there will be announcements of this hands-on training. So
I
we'll
love to
keep
hear
our
people's feedback about the multiple modalities that we're trying to introduce, let people get their hands on devices before they go out and purchase one. And so we're probably introducing 5 modalities.
And that leads to another question from Lauren Miller. What is the cost of the LymphaTouch?
So the LymphaTouch has a couple different models. They have a Pro model, which has just come out, and it's a lot sturdier. So that's probably, we're looking about maybe 6,000 or 7,000. That's really used for people who use it with every patient, people like me. And then they have the LT one, which is a more of a user-friendly device that's more portable. And I'm guessing it's probably in the $5,000 to $6,000 range. I really haven't checked the prices. You know, everything's been going up, inflation.
So stay tuned for that as well. And as we are wrapping up, and by the way, lots of wonderful comments in the chat.
Thank you.
Sarah Brownhill is saying that her massage therapist used to use cupping to desensitize her lipedema areas before the deep tissue massage.
Okay.
So that was interesting as well. And many thanks coming into Lympha Press for hosting this. We do this pretty much every month. If you are subscribed to our link tree, which you can find on our website, lymphapress.com, or Instagram, there's always a link tree, link in bio. You'll get alerted whenever we have new material coming up. In addition to the webinars, we have our patient roundtables. And on the first Monday of every month, a clinician roundtable that is really anchored by Karen Ashforth and Dr. Karen Herbst. Awesome stuff. We believe in supporting you as you take care of patients, and we believe in supporting patients so that they can manage their conditions and live well. So with that, do you have any final words for us, words of encouragement, overall statement as we end today's webinar?
Well, I mean, I'm looking at these amazing comments and like people I know, people I don't. I mean, thank you so much. It's always so difficult to put yourself out there. I mean, I'm nervous and, you know, but I just love technology and I love sharing, you know, something. I love gadgets and modalities. So thank you for coming and thank you all these people that came tonight. Thank you.
Yeah, it's wonderful. And thank you for your hands-on work, which is irreplaceable. We just love having the tools to augment so people can manage at home and keep the momentum going of the hard work that you therapists are doing in your clinics. Louisa Boyd, what a pleasure to be with you this evening. Thank you. Come back again soon, okay?
And yeah, you all come see me. Thank you.
All right. Have a great night, everyone.
All
Thanks
right.
for joining us.
Bye, everyone.
Bye.